Hello, and welcome to today's episode of The Scoop, where seniors can overcome obstacles proactively. My name is Denise Jaworski, and with me here today is Dr. George Wilcox. Dr. George Wilcox is an ABIM board-certified internal medicine physician with 28 years of experience, and over 7 years of those have been in the San Antonio area serving as a medical director for local area hospices. Today, we are going to be discussing specializing and improving the life of those with life-limiting illnesses. We thank you so much for joining us today and discussing these topics that are so important for our community to hear. So the first question I have for you is, please share with me why you decided to pursue a role as a hospice medical director.
My day job is an internal medicine hospitalist. So I only work in the hospital with acutely ill patients. And over time, as our population has aged, people are dying more. And we were having a big gap in the transition of care from the acute care to the end of life. And the culture of medicine saw end of life sometimes as defeat. And so it was not a very open topic for a very long time. It's become much more palatable to talk about hospice now. But I thought there was a large need to start having the conversation and educating people, because we can't fix everything. And sometimes the right thing to do for the patient is actually to let them pass away in peace with dignity.
Do you find starting those conversations with families being difficult?
Often not as difficult as you think. Most of the time, family that's engaged with the patient, they know what's going on. They may not want to admit it,
right,
but they can see it. Patients usually know before the family does. And if you have an active patient who's competent and involved, they'll drive the conversation if you get them talking about it. They don't want the tubes and lines and chest compressions if they aren't going to help. And that's what it comes down to, is when are you doing something to the patient and not for the patient?
Right. I think those would be very difficult conversations to have in that setting, especially.
They're emotional, not necessarily difficult.
Yeah. And the family, you see a lot of times is the family involved in helping, or do you see the patient leading it more?
Usually it's the family. The patient almost gives permission to have the conversation. The family then becomes the driver of the decision making once they know it's okay to pursue it.
Yeah. It's almost like
families see it as giving up, and they don't want to give up on their loved one.
Makes sense. I think that's hard. In my own family, when we had to make those decisions with my stepdad, it was very difficult. Again, you almost feel like you feel guilty to be the one to bring the topic up.
Right.
And the doctors who seem to help navigate that the best for our family. So I'm sure you're in that situation a lot.
We go through that conversation a lot. The family goes through it possibly once.
Yeah. Yeah. So tell me about some of the outcomes that have been disappointing to you that have happened with someone that has been put on hospice.
I think the theme of the disappointing situations are where you have a patient on hospice and they're declining as expected. They're comfortable, but perhaps they have an illness, a component of the illness that's not exactly comfortable for the family. In a case very recently that I can think of, there's a gentleman who was dying of respiratory illness and progressing and fairly near the end of life, but he had vascular disease as well and had an ischemic limb. So his lower leg was dying and it had an open wound, and it was not pretty. It was, you could see bone and tissue, and it wasn't bleeding, it wasn't oozing, it wasn't infected, but it was progressing, and it was everything below the knee looked like something out of a movie.
Oh, wow.
And we were keeping it covered, keeping it moist, doing medically what was necessary for it. And as we progressed, we were, what I felt, within a week of probably end of life. And one of the family members just could not take it anymore and got him to the hospital. The surgeon was called. They were going to potentially operate. Then anesthesiology said not stable, which is appropriate. And the patient ended up dying in the hospital. And in these times where were limiting visitors.
Right.
They had 1 or 2 family members around, which is not what they wanted. They wanted to die at home with all their family around.
Yeah.
And it was sad to watch the family who had come to the difficult decision, in the end, not get what everybody wanted.
Right. Yeah, that is actually a very disappointing story.
Yeah.
But I can also see why that they would be led to. I think it's hard to sit and watch someone that you love suffer, and feel like we're doers, right? We want to do something.
We want to fix the problem.
Fix the problem. Yeah.
That's a good point.
Yeah, I think that would be hard for me.
Yeah.
Tell me about some of the outcomes that have surprised you or touched you as a medical director that have been positive.
I think so many of them are positive. I think when you have a family, I have a very good one. I just thought of.
Okay.
A retired physician.
Okay.
An osteopathic physician like myself. He had been around forever, and
tough patients.
We talked. It could be. We got to know each other very well. He had multiple pulmonary problems. He had both COPD as well as a very large pulmonary embolism, as well as some congestive heart failure. And we got to know each other very well over a course of several weeks in the hospital. Got to know his family very well. He had 3 daughters, one of which was clearly in charge of everybody. And he was getting very aggressive treatment, and he was competent and aware, and he wanted everything done. And he was intubated once and came off the ventilator, which was surprising to us, and was on BiPAP, which is CPAP machine, a lot. He was very dependent on it and couldn't even come off of it long enough to eat. He'd received treatment for pneumonia, maximum treatment for everything. Blood clots were resolving, and he was still declining. And he became aware pretty quickly of the end is near. Being a physician, at first he was typical physician. Let's attack this. Let's go after this. Do everything. And then he started to separate from it a little bit and look at it from the outside. The family was not as quick to come around, particularly the one daughter. The other daughters actually were agreeing with hospice. The conversations were being started. Palliative care was involved. He finally kind of turned the corner, but yet the wife who took the lead from the one daughter, they were both still very resistant. We spent a lot of time together, more than I typically have the opportunity to, because typically when people are declining, it's not as slow and steady as this one was. And we finally made the decision, and he was sick enough that he stayed in the hospital on hospice. And there was a peace about them. And I went by and visited, and they're all in the room, and there was no more battle. They weren't fighting an enemy anymore. They were just with each other for the first time in weeks.
It was just quality.
Yeah.
And I don't think that there could be a better outcome with hospice than that
Right.
peace of mind and quality at the end of the journey.
Right. And they respected him. They respected his wishes. I think they can sleep at night with that.
Yeah. That's awesome. That must feel good to be a part of that.
It was very emotional, that one.
Yeah.
Not all of them are.
Yeah. Yeah.
Well,
I know.
So many of them you don't get to spend that much time working with.
Right.
I was weeks with him.
Well, and that's one of the reasons why we're trying so hard to educate on this topic that a lot of people don't talk about, because sometimes we find that they're going on hospice too late in the game. And it's all these reasons that we're talking about that they need to be discussed, and people need to realize that they're not the only ones that are having to deal with these emotions and feelings, so that the end can be exactly like your last scenario.
Right. That's the one thing I would say about hospice, and it's changed for the better, but it generated a lot of my involvement was this too late. You don't get hospice on the way to the funeral home.
Right. Yeah. And unfortunately, we still see a lot of that, which is okay. As medical professionals, we can try to handle that the best that we can, but we're still going to be there for them. But our passion right now is on trying to promote as much as we can. We thank you so much for your time today. Is there anything else that you would like to just throw out there that you think that would be important for seniors or their adult children?
I think that the most important thing to consider here, and I say it to my patients, is when I call hospice, it's just a conversation. And it's one more piece of information, one more tool in the bag. You don't have to use it, but it's worth having the conversation.
Absolutely. That's awesome. Well, thank you guys so much for joining us for today's episode of The Scoop. Please stay tuned for more. If you're interested in Abundant Hospice services, call the number at the bottom of the screen or visit their website at abundanthospicecare.com.